Hi, I'm Dr. Lydia Knudsen, developer of Axial Stability Method, an emerging chiropractic approach to human biomechanics. In part one, I said that neck injuries can take down a wide swath of the sensory system, and correcting muscle imbalances in the rectus capiti can bring the whole sensory motor system back to normal functioning. In ASM, when we approach the triad of equilibrium for treatment, we first must assess where in the sensory motor system there is the most stress. Is it with sensory collection, sensory processing, or motor output, or perhaps all three? Okay, so that's a lot of things to check in a conventional 15 to 20 minute chiropractic visit. But if we remember our role as biomechanic and keep our focus on the proprioceptive system, using muscle testing, we can check for where in the sensory motor system the biomechanical injury is having the most destabilizing effect. Remember, all proprioceptive data and most other sensory data is sent to the cerebellum for processing. If the data is faulty, for instance from over or under facilitated upper cervical spine muscles, the signal-to-noise ratio may exceed the cerebellum's capacity to quickly parse useful position sense information. Questionable data is costly to process. It takes time. This bogging down of the sensory processing system can actually interrupt the processing of other sensory data. So, an inability to concentrate in a noisy environment, poor eye tracking across a page, or even emotional lability can all be the result of faulty proprioceptive data due to injury to the neck. That's a powerful concept, especially for a chiropractor. So when we approach treatment of the upper cervical spine in ASM, we understand that many symptoms may be involved and affected by the upper cervical spine injury. The more information we can find out about the extent of the effects of the neck injury in the individual patient, the more effective our chiropractic correction will be. So, starting with the biomechanical system as our context, the joints and muscles of occiput and atlas, we first check the visual system, because the visual system is so linked to the postural muscles of the neck, in particular the rectus capiti. We check some of the major functions of the visual system. We check convergence, divergence, tracking, the focus peripheral visual system, and of course, the vestibular ocular reflex known as the VOR. When warranted, we also check the auditory system as well as possible unintegrated infant reflexes. When we identify stress in these important functions of the visual, auditory, and vestibular systems, we alert the body to these problem areas. This is part of our biomechanical treatment setup. By having this neurological information on the table, as it were, we are deliberately setting it up so that when the proprioceptive system reorganizes itself post-treatment, it also reorganizes all this sensory data and sensory processing at the same time. What gets put on the table for reorganization is different for every patient. This tailoring of treatment can make all the difference in especially difficult sensory motor breakdowns, especially after concussions and other cranial injury. But we actually check all these systems even when someone presents with garden variety neck pain. The depth of reorganization in the sensory motor system can be truly life-changing for anyone.